a review or an inspection or an investigation in a hospital or care home or anywhere else. If the team identify on that day an issue that's putting patients in immediate harm's way, they will not leave the site that day till they speak to the person in charge and point it out to them. And they expect a response that day, the next day, but it's immediate. That's what we mean by immediate. It must be acted on immediately, no delay. It must be done hastily. I'll give you some modest examples. You go out to a ward and you find vulnerable adults at risk of choking with a lack of supervision and support at meal times. That must be acted on immediately. We won't wait. This cannot wait for a report to be written and send it to you 28 days later. No, that must be acted on today, and we want assurance today. Environmental issues, fire hazards, medicine trolleys not properly managed, or mismanagement of medicine, immediately. But the other bit of those immediate actions must be that it is reasonable for the trust to be able to act. So you and I know that people come to harm when they're queued up in ambulances at our hospitals. Yeah. You and I know that people are coming to harm in our crowded EDs despite the best efforts of staff. They're coming to harm. It would be unreasonable for RQIA to go in and say, resolve the ambulance queue immediately. It is not within the ability for them to do that day. But they must deal with issues within that. So, for example, there may be actions required in ED to make sure that if you have a spill-out area, it's definitely not desirable, and are people coming to harm? Yes. But are we clear who's in charge? Are there medicine card decks available? Is there good infection prevention control going on? Those are immediate issues. So when we said we found no immediate patient safety, there was nothing the team saw on the day in their observation or in the information they had that they were able to say, or the environment, that they were able to say, that's to be resolved today. But 2 issues were urgent and all other issues were prompt. We're demonstrating there these need to be completed at peace.